Hi, my name is Bob. I'm 73 years old. I'm celebrating 2 milestones today. The first is 6 months since my cervical spinal laminectomy at C3 and C4. And the second milestone is 3 months since my lumbar fusion L4, L5. The scars, I think you can see from there, 5 inch or so up my neck, and two scars either side of my spine, just above the belt line. I did everything I could to avoid this surgery. First, I should explain that this is not a propeller hat going on above me. The propeller hat I wear doesn't spin. So recovery is no picnic, but the results are worth it. These surgeries took care of all of my symptoms, and I'm glad I did them. Right now, at the 3-month past fusion, past the lumbar, I have a little stiffness in the lower body from the waist down, and I have no stiffness at all from the laminectomy. The neck is as if it never happened. Things I tried first were PT to build a strong core, pain meds, meloxicam. Finally, I got an MRI, which showed that I had spinal stenosis at the L4, L5, caused by spondy. I opted to have the surgery done in Maine during my summer vacation because, after all, how hard could it be? Well, I was in for a surprise. I went to Maine Medical Partners Neurosurgery and Spine, and had an appointment with Dr. Douglas Buxton, who determined by pre-screening that I also had cervical spinal stenosis. He did it by tapping my knee and tapping different places, but the knee was a big thing, and my foot just about kicked him in where it hurts. the response, my foot it went flying. So then he did a Huffman's test, where he takes and he flicks the middle finger, and the index finger and thumb pressed together. That's an indication of a pinched nerve in the neck. Probably indicates other possible things, but that's what it turned out to be. He also found that I had clonus by pushing back on my foot and then holding the pressure on, and my foot, either foot, both of them, just sat there flapping. So he had an MRI done on me, and it revealed stenosis at the C3, C4, and that was the more pressing operation. So on July 27th, Dr. Rajiv Desai performed the cervical laminectomy to relieve pressure on the spinal cord. I was released from the hospital the next day. I had oxycodone prescribed to me, as well as instructions to take Tylenol as required. I received a hard collar and a soft collar from the hospital. I still wear the soft collar today, not for support, but just to remind me to keep my posture good. And I use it in bed still every day because it keeps me lined up. So the importance of good posture has been very much impressed on me. At home, the first few days were quite painful. I had a heck of a time a heck of a lot of pain in my in this region here. Every time I got up, I got an additional prescription of prednisone, and that took care of the pain pretty well. So I recommend you get a cane or a walker, because you're going to need it. If nothing more, to get off the toilet when you're. And you'll also need a seat to sit on in the shower, because you will have trouble standing for very long periods. After about a week, I was off of the pain meds. I felt pretty good. I was driving after a week. After 1 month, I was taking about 2 Tylenol a day max when I needed it. After 2 months, I was completely pain-free. I was out and about, and like nothing ever happened. After 3 months, of course, I mean, it's even better, like nothing ever happened. To take care of my excuse me, my range of motion is somewhat reduced, mainly because I don't press it hard. I don't want to pop a screw. So in certain situations, to cover certain situations, I bought, while I'm driving, I bought a blind spot mirror. It's adjustable, so I stuck an identical one to this toward the outside of my mirror, adjusted it so that I can see 45 degrees back that way when I'm on a 45 degree road approaching, shoulder approaching road, because my neck won't swivel 135 degrees anymore. A week, 3 months after that surgery, I opted to extend my main vacation and have the same surgeon do my fusion. So on October 26th, Dr. Desai performed a second surgery on me. It was called a minimally invasive posterior lumbar interbody fusion. You can look up PLIF, Google PLIF, and find out what it is. You probably already know, or you wouldn't be watching this video. I was released from the hospital the next day, which I haven't met anybody else who's released so quickly. One issue was that Medicare, as you have determined by now, I'm on Medicare, and Medicare had issued me a letter indicating that they would approve 1 night in the hospital. So 1 night it was. So I consider myself to be Medicare tough. The hospital sent a walker home with me, and the same prescription, oxycodone and Tylenol, with instructions not to bend, lift, twist, or reach, and not to lift more than 8 pounds, which is a quart of milk, and to hold it, keep it close to your body as you lift it. The first few days at home were the most painful days I've ever had in my life. Not so tough anymore. Again, I was issued prednisone to take care of the pain, and it worked. I used 3 times as much oxycodone for the lumbar surgery as I did for the cervical surgery. It gives you I guess about 3 times as painful. I took the walker into the shower. It's an aluminum walker, and it was really handy to use your walker in the shower. Also, I got a toilet seat with handles on it because you have a really weak core And so it helps to have the handles to stand up or lower yourself down. I was driving after about 2.5 weeks. It's getting in and out of the car is still to this day, 3 months later, really the most difficult thing that I do on a day-to-day basis. It is a pain in the butt. You're not supposed to bend, lift, or twist. How do you get into a car without bending or twisting? You don't. For nutrition, I took more protein and calcium than I normally do. Things like Boost, cottage cheese, protein bars, almond milk, and chicken. And one thing I found to be very useful is a bath towel rolled up so that when you have to sit, you just position this just below your rib cage, and it provides great support and keeps the load off of your lumbar region. After 1 month, I was taking 2 Tylenol a day. They ask you to do a lot of walking, standing, and minimum sitting. Minimum sitting doesn't mean lay down a lot. There's only sitting and standing that you will do during the day. So that means you're doing a lot of standing and a lot of walking. And what I did is, to entertain myself, is set up my laptop on a couple of boxes on my desk. So I made myself a makeshift standing desk. And I took courses from edx.com and from, I joined chess.com, where you can play people from all over the world at a level, at your own level. My level was not good, but it was entertaining. At the end of 2 months, I still felt a knot in the back and my back, presumably from the hardware left over from the surgery. I didn't have any pain, any of the original type of pain that I had. For the first 2 months, I needed help putting on my socks and shoes because it basically takes 2 hands. Finally, after 2 months, I figured out a way to put on my socks and shoes with one hand. At the end of the 2 months, I was cleared by Dr. Desai to fly home. Of course, by this time, it's New Year's Day, and so we flew home to Florida from Maine, and that marks the end of our summer vacation. Now I'm going to the gym most days. I really use the treadmill, elliptical, the bike. Try to get 30 minutes on those at cardio, out of breath. I don't walk fast or pedal fast. What I do is just set the incline on the treadmill pretty high. And so I don't really jar myself as I'm walking. So I'm not jogging. I'm just sort of climbing to get my heart rate up. I do some not bench press, but some machines that don't put a lot of strain on my back this way. I do mostly in this direction. And again, I stand most of the time. Most days I walk about 7,000 steps. I have no problem walking 10,000. I don't usually walk 10,000 2 days in a row. I also have no problem walking about 1.5 miles. That's what's comfortable. I have walked 2 miles, but then that puts me kind of out of commission for the next day. So that's where I am with that. So One thing I found out that I really missed out on, and so I'll give you advice if you get your surgery done in Maine. Maine has a medical marijuana law that allows you to get a medical marijuana prescription. So instead of suffering all that time, I could have been like enjoying the vapors. So rest assured, if I go back for a surgery in Maine, I'm going to get me some marijuana. So one more thing that I'll leave with you is if you Google lumbar fusion protocol, you'll get, if you don't have physical therapy, you'll get a list of the therapeutic exercises you can do weeks 1 to 6, and then a new set of exercises weeks 6 to 9, and so on. That's lumbar fusion protocol. I hope this was useful to you. I'm happy as a clam. All symptoms have been relieved. The recover is no picnic. I know I got to take it easy for at least the next 3 months. I did try golfing yesterday. I went out and I didn't take a full swing or anything like that, but I just did some little bump and runs. So my partner, I played off of her drive and then just bumped and ran to the green and then putted. So it was fun to get out. And it got me the opportunity to walk on non-smooth surfaces for 9 holes. I really felt it the next day. So I hope this is useful to you. I'm happy as a clam in summary, and see you.